So more often you'll see it called lateral flexion, flexing to one side or the other. For this one joint, we have special terms for the rotation. When you do it, what turns is your hand. The special terms are pronation and supination. And these are based on the words prone and supine, which is lying on your belly versus lying on your back. The names correspond to, if you had your shoulders flexed, which side of your hand is ending up down. So when you supinate, you put the back of your hand down. When you pronate, you put your palm down. With the shoulders extended, pronation would turn your palms back. Supination would turn them forward. So the anatomical position, everything's extended, and your elbow pivot joint at the radius is supine, or supinated. Another way to remember is if I'm holding a drink and I pronate my hand, I'm going to pour it out. If I supinate my hand, I can hold a cup of soup. So this is a one joint pair of terms. It's only for the radius at the elbow, just as dorsiflexion and plantar flexion are only for the ankle. There's a second set that's only for the ankle. These are comparable to abduction and adduction of the wrist, but because if you look closely, the foot isn't really moving as much as the fingers do in abduction and adduction at the wrist, they're giving it a term just for tilting. It's inversion if you're turning the sole inward, eversion if you're turning the sole outward. So because the part's not really moving, just tilting, they didn't want to call it abduction and adduction. And the last grouping is up and down, forward and back, when it wouldn't count as a different movement. Like bringing my arms forward counts as flexing my shoulders. But if I actually bring my shoulders forward, then it's protraction, bringing something forward. When I tell you to stand up straight, pull your shoulders back, that's retracting your shoulders. When you shrug, you elevate them. And when you put them down, you depress them. The shoulders can do all of those, and that's happening at the gliding joints, where you're actually moving the scapula, as opposed to at the ball and socket joints, where you get flexion, extension, rotation, abduction, adduction. You can also protract and retract your head and your jaw, where if you bend your head forward, that's flexion, bend it back, hyperextension. And then when you chew, you depress and elevate your mandible. So when we get to the muscles later today, you'll see there's a couple of strong muscles for elevating the mandible so that you can get some force into chewing your food.
What's the back, the area of the back of our neck, mouth? Right there.
Which one?
Right there in front of you.
This one, yeah, she is, if you look closely, you can see her chin and lower lip are shifting, not a lot.
So what are them called? Them two?
That's protraction, as you're pushing it forward, or retraction when you push it backwards. on movements. Last thing for the chapter is a brief look at joint disorders. Somebody asked about sprains last week. This is when the bone is okay, but the connective tissue of the joint is damaged, which could include a meniscus, articular cartilage, ligaments, or tendons. These can be slow to heal because all of those tissues have a poor blood supply, but then they're usually not as difficult to work with while you've got it as if you had broken a bone. Arthritis is joint inflammation, and that's actually what it means. Arthro is joint, itis is inflammation. The most common type is osteoarthritis, which even though it means bone arthritis, it's actually the articular cartilage that's damaged. So if this wears down or gets rough, then you don't get as smooth of a movement, and you can actually even get to where the bones are scratching each other, and so the joints would hurt all the time. Rheumatoid arthritis is an autoimmune disorder where the body attacks the joints. That causes the synovial membranes to get inflamed and can even cause damage to the bone. And then one type of arthritis that's actually a disease that you can get is Lyme disease. It's a bacterial infection, but clusters of the bacteria with your immune cells can get deposited in the joints and cause inflammation. This compares the tissues of a healthy joint, advanced osteoarthritis, and rheumatoid arthritis. So here's our articular cartilage with a slip of synovial fluid between. With the articular cartilage worn down, the bones can rub together, and that can be painful and damage them. In rheumatoid arthritis, the articular cartilage is fine, but the synovial membrane is inflamed, so it's swollen, it's got an increased blood supply, so it's hot and red, and the immune system can actually damage the bone within the joint capsule. Down here. Questions on arthritis? Right, so that's the end of the chapter. We'll take a break here, come back and do some of chapter 8 before we head over to the lunch and learn.